Oh, it's great to work here. We work in a diverse community.
Labor and delivery is a place where you see people having fresh starts in their life. Because we have such a diverse population, so many new immigrants, it's a moment that has a lot of hope.
While we have an amazing set of providers, we have a hard time providing continuity of care.
I really believe that all the staff on the labor floor want to be able to center the experience of the patient, but there are also logistics that come to bear.
Sometimes there's long waits, sometimes they're seeing a different provider every time. It's a challenging system that people are in when they're trying to receive care here. We are facing a crisis in maternal mortality and morbidity in the United States. And those that are suffering most are those birthing people who are women of color.
This country has a lot of money and they have the worst stats. Something's got to change for these numbers to change.
And while there may be multiple solutions or multiple ways to improve quality to access healthcare, one critical component we think is providing something like doula support.
So this is what the labor room would look like. So this is over here.
Community-based doulas would fit into the hospital team by being the conduit between the patient and the healthcare providers.
I think on labor and delivery, everybody knows the role.
I get really excited when I see a doula because even though they are not necessarily doing clinical work, they're providing the support that's necessary. And a lot of research actually shows that support emotionally for the patient, even just having a person in the room, significantly enhances outcomes.
Doula has many hats. We do so much. We kind of fit in where we're needed, and we have to adapt to where we're needed.
If you are a person that has been incarcerated or you're houseless, you can get a doula. It is accessible to you.
Que no importa su estatus migratorio, no importa su condición o clase económica, tienen acceso al programa.
And a lot of times doulas take care of the patients before, during, and after delivery.
At the HOPE program, we provide community-based doula training, which is a step above the traditional doula training because it has that cultural competency component.
A community-based doula is special. That person comes from the same community as the patient themselves.
We come to our clients with this rounded out view of what they might be going through.
Doula service আপনি একজন বিশ্বস্ত মানুষ পাবেন, like as a mother, like as a sister. ওই সমস্যা থেকে আপনাকে রিকভার কিভাবে করবেন এই ইয়েগুলো আপনাকে বলে দিবে।
Tratamos de brindarles mucha más información y mucho más soporte para que ellas puedan tener un parto satisfactorio y obviamente nosotros continuar apoyándolas durante la etapa del posparto.
Come in.
Hi, it's Dr. Maru.
I found out that I was pregnant. I ended up going into the shelter.
Having a client who lives in the shelter is not easy. So for me, it's important that she gets all the information and everything she needs to have a safe environment and a healthy family.
She made it seem as though she was a part of the family.
She helped me out, not just with the labor part. She also helped me find different programs, pantries and clothes.
I would say she helped me with being attentive.
How precious.
She showed me how to be there for her.
To deal with this mortality crisis that we're dealing with, everybody has to be on board. This is not going to work unless we work as a team.
Even if the physical space is limited, everybody has their own role to play and expertise to bring to that environment.
They are part of our team and we should be advocating for them just like I would advocate for my nurses. Everyone should be supporting each other.
আর পুরো লেবার রুমে আপনি ছিলেন আমার পাশে অ্যাজ এ আমার ফ্যামিলি মেম্বার। যে পেইনটা নিতে পারছি আপনার সাপোর্টের জন্য আমি এখন পর্যন্ত মনে করি।
As doulas, we really just want to make a change in the way that women experience birth and experience pregnancies.
I've been happy.
Yeah? Aw, that's awesome.